Finally, according to our sources, ominous rumblings from Iceland are not another imminent volcanic eruption, but in fact rumors of decriminalization and possibly more. Helga Sif Friðjónsdóttir is here to tell us more. Helga is the Deputy Director General of the Ministry of Health in Iceland and adjunct and clinical assistant professor at the University of Iceland. She is a pioneer in redesigning mental health and addiction services with a nursing background focusing on drug users and those with mental health issues. If you have any questions for Helga or our next speaker, we're going to be using Slido through the whole conference. You can log on here. You don't need to download the app. You just go to the webpage and the code is there, 232323. It will also be on the slides in between talks just in case you miss it now. Helga's presentation is titled, Are We There Yet? Development and Changes in Drug Policy in Iceland. Please welcome Helga Sif Friðjónsdóttir.
Thank you. Okay, thank you so much, Dominic, for the pronunciation of my name. It was almost correct. And I would also like to thank the people who organized this conference for inviting me here. I'm really happy to be here today, and I look forward to spending the next 2 days with you. And I would also like to thank you all in the audience for being here. It's I can't really see you though because of the lights, but hopefully in the break we can talk some more. I would like to start this presentation on a personal note. As Dominic said, I am a nurse, and unfortunately I graduated in 1999. That seems like a lifetime ago. And I started working at Iceland's main detox and treatment center. In September 2001, I was preparing to go for a conference in the US that was organized by International Nurses Association on Addiction. And I was looking through the schedule to see what workshops or presentations to attend. And I noticed a workshop on harm reduction. At that time, I didn't know what harm reduction was, so I asked one of the doctors at the treatment center about it, and his answer was like this. We don't need harm reduction in Iceland. The focus is on treatment here. So you should select something about treatment to go to. And then unfortunately I wasn't able to go to the conference because of these September 11th attacks and everything that happened after that. But I moved to Seattle in 2002 to do a master's and a PhD program, and there I heard about harm reduction again. Soon after I moved, I joined a volunteer program that was a collaboration between an NGO and the University of Washington to provide health services to homeless youth in the city. This experience transformed my world and everything I learned in relations to helping people who use substances. And professionally, I understood and experienced firsthand that it is possible to provide healthcare without focusing on getting people to treatment. I moved back to Iceland in 2007, and 2 years later I found myself leading the development of Iceland's first needle exchange program in collaboration with the Icelandic Red Cross. So really in the beginning, my involvement in harm reduction was based on a healthcare worker's view and the need to create services that would minimize healthcare risks for people who use drugs. But it wasn't until later that I understood that being involved in harm reduction, discussion, and development is really anchored in human rights, discriminalization, and drug policy reform. And then when I was asked to give a talk here today, my first reflex was, of course, looking at it through the lens of healthcare worker and give an overview of the development in Iceland on harm reduction interventions and progress. But I was also asked to talk about the process of decriminalization in Iceland and give an overview of the initiatives and discussions that have been made. And then when preparing, So when preparing for this talk, my mind kept wandering back to Donkey. Donkey is one of my favorite characters in the Shrek movies. Perhaps you've seen the movies. And there's this one scene in Shrek 2 where Donkey repeatedly asks on the way to the kingdom far, far away, "Are we there yet? Are we there yet?" It's an annoying scene. It takes like 1.5 minutes or something where that's repeated. And that's indeed how I have often felt over the last 14 years. Are we there yet? But I've also wondered, where are we in Iceland exactly going in relations to decriminalization and drug reform? What needs to happen so that we could all share the same vision and understanding of our destination? And on what journey are we exactly? So let me try to give you an overview of some of the milestones that we have passed so far. So as I said, the first official signs of harm reduction in Iceland is a needless change program that the Icelandic Red Cross began operating in 2009. It's a volunteer program. There are 3 people, staff members, and then around 80, 90 volunteers at every given time. It used to be in a motorhome, which was really hard for access because we couldn't access the areas where people who are using tend to be in the city. So in 2012, we moved on to the van that you can see in the bottom there. More on that note. So what I did was kind of try to create a timeline then of what has happened in different areas in Iceland. And so here you can see what is happening on the timeline in developing harm reduction for NGOs. All right. So the needless change program is called Frú Ragnheiður. Try to pronounce that. It operated originally in the capital area, and it's a needless change program and a basic healthcare services. So primary care, because we have a lot of nurse volunteers in that program. I'm not sure where to point this. So 2010, the women's shelters opens, or it was opened, but the women's shelter decided to operate a needless change program within the shelter and introduce harm reduction philosophy in the whole service. 2014, there was a day center run by the Salvation Army. It's now closed, unfortunately. They introduced needless change program 2016, a little bit ahead. Again, the women's shelter, they created a safe place to use inside the shelter. Remember, we're still operating under the current laws and regulations in Iceland. 2018, Frú Ragnheiður was developed in Akureyri, a town up north in Iceland, and then also we started antibiotic programs so that people could come to the service, get assessment for infections, and then get the medication as well. 2020, Frú Ragnheiður opened up in a town in the southwest called Reykjanesbær. 2021, the Icelandic Church Aid opened a day center for women based on harm reduction philosophy, and there's also a safe place to use inside that. And then Frú Ragnheiður in 2022 started a naloxone distribution program. It's in all 3 areas that Frú Ragnheiður is operating, and it's financed by the health ministry. So what is happening in welfare service in the municipalities? Borgarvarði, there was a program, was an outreach program for marginalized people run in the capital area. They provided needless change as well from 2014. This program has been discontinued. 2019, the shelter for homeless men at Lindargata decided to open up a needless change within that services. And then the Division of Service for Homeless and Marginalized People in Reykjavik made sure that needless change was available in all of their services. 2021, the division again implemented harm reduction philosophy in all of their services. 2022, the first DCR opened in Reykjavik City. It was an experimental project of 1 year, and it's actually one of the things that we have changed in the current legislation. Let me get back to that a little bit later. This experimental project is now closed. I think the final shift was in March, and the city is now working on finding housing to open up a permanent DCR, who's not like a mobile one. And then what are the healthcare services doing in harm reduction? So OST has been available, but in the main detox and treatment center, obviously with the medical model focus of it. And later it has been available in the National Hospital, and we have a little bit of a harm reduction underpinning the OST in the National Hospital. It's not official though. 2016, we had a hepatitis C project, a 3-year project, and the aim was to eradicate hepatitis C in Iceland. Iceland is a perfect laboratory actually for this. You might have read some of the articles about this. The thing that really was the harm reduction piece of it is on here on the bottom. They develop emergency boxes, and in the boxes there are tools for people to use intravenously, and it's distributed. The boxes are distributed, and all of the primary care clinics in the country can order this and have it available on site. Some of them are, not everyone. And then 2019, a mental health service team was established in the prisons, and they had OST available then in the prison. It wasn't until 2019 that you could have that available. 2020, we had a farsóttarhús, another name, Icelandic word you can perhaps practice on. It's a governmentally run quarantine and isolation facility that was run during the whole COVID epidemic. And we created the mental health services at Landsbytali, provided harm reduction services on site within that setting, and in collaboration with the welfare services at Reykjavik at some of the points in time. 2021, the outpatient infectious disease unit at the National Hospital created a low threshold service collaboration with some of the NGOs and the welfare services in Iceland for people so they don't need to go to the emergency department. They can just contact the outpatient unit and be treated for infections directly. Okay, then we're on to the parliament. That was the main purpose, basically. So what is happening in the policy reform discussion in Iceland? The first sign of this being discussed in the parliament can be found in official records from 2013 in the 141st parliamentary session. At that time, Birgitta Jónsdóttir, who is a MP for the Pirate Party in Iceland, submitted a parliament resolution that highlights the need to create a policy intended to integrate measures that decrease demand for substances based on humanistic, realistic, and normative views that should protect people who use drugs, their families, and society. This resolution wasn't passed in the parliament. And then in 2014, here. In the 143rd parliamentary session, Birgitta submitted another resolution stating that a committee should be appointed to develop a policy aimed at decreasing direct harm and related harm of substance use, where the goal should be to help and protect people who use drugs and protect their social rights as well as their families and society. Alþingi passed this, or the parliament passed this resolution, and the Minister of Health was tasked with appointing the committee. And believe it or not, these 3 lines was actually the name of the committee. It was really hard to tell people that you were serving on that committee because it took such a long time. There were multiple stakeholders in this committee. I was fortunate enough to be the representative for the National Hospital at that time, but there were no service users on that committee. So this is in 2014. 2016, the committee's report was put forth at Alþingi, and really in the report, they were tasked with creating a policy, but the committee didn't really do that. So there was no policy created. However, there were 12 suggestions made in 4 different areas, or 4 changes. So suggestion about laws and regulation that should be changed towards decriminalization, and negative effects of punishment on people who use drugs, some suggestion about harm reduction measures, some suggestions about increase and develop treatment options, and then maintain the success of prevention in Iceland. I'm gonna save the best for last, so I will talk about 1 in the 2, 3, and 4 first. So these are the suggestions about the harm reduction measures. The access to needle exchange service should be created, and we have now still through Ragnar operating in 3 different places, and we have the hepatitis C boxes that I spoke about earlier available for all of the primary care clinics to order if they so see fit. We have low threshold HIV and hepatitis C testing available without payment. First through the hepatitis C projects, and then after that finished in collaboration with low threshold services, the National Hospital and the main detox and treatment center. And as I said before, we now have created the low threshold services at the outpatient infectious unit. And in the prisons, there is OST available, and that's the only harm reduction intervention there. To increase and develop the treatment options, there is a little bit of development on this. There has been a treatment unit created at the National Hospital for young people under the age of 18, and that's really the only new development in the last years. And then again, there was a mental health service team established in the prisons and is still servicing the prisons or the people. For number 4, maintaining the success in prevention. There was a work group appointed that created suggestion on implementation of mental health promotion, prevention, and early intervention for children in schools in Iceland, and that's ongoing and being done through the Ministry of Education, working on this. And then we have ongoing research in schools, the ASPAD, for example, and the Planet Youth Project, which is a Icelandic prevention program you might have heard about. Right, and then save the best for last. So what about the suggestions about laws and regulations that should be changed towards decriminalization? There have some changes been made. So for minor drug possession offenses, not in the criminal records, fines for possession lower than 100,000 Icelandic kroners are not recorded on the criminal records. And then blood testing is needed to examine if a person is driving under the influence. It used to be urine or blood, but now they changed the traffic law in 2020 so that it's only the blood testing. The drug consumption room, the laws regarding drug consumption room were passed in 2020, and the regulations regarding that in 21. And the suggestion about people should not go to prison for possession of substances for personal use. So let us just go to the timeline and the overview. It's much easier to look at it this way. So as you can see, 2016, the committee submitted the report with 12 actions. And again, it's not really a policy or action plan, it's just suggestions. So there was not really a demand of executing all of them. But the Minister of Health decided in the spring parliamentary session 2019 to change the legislation on controlled substances so that we could open up and operate a DCR. At first in the spring it wasn't passed, but then it was resubmitted in the fall by the Minister of Health. And at that point, it got passed. At the same time, you can see in the top that Helga Mogensen, who is the MP for the Pirate Party at the Parliament, she submitted a bill on possession and buying and receiving drugs within the threshold for personal use. So the first sign of decriminalization in Iceland being discussed in the Parliament as a drug reform. And then you can see that 2020, it wasn't passed in 2019. She submitted it again in 2020. And it wasn't passed then either. And then in 2021, there was a lot of discussion both within the Parliament and then just within the society as a whole about drug reform and the need for Iceland to step up. So Helga submits the bill of decriminalization again, and the Ministry of Health submits a bill on decriminalization for personal use as well. So a governmental bill was submitted, but it didn't go through the Welfare Committee, so it wasn't voted on in the Parliament. So 2022, Helga, the MP for the Pirate Party, submits the bill on decriminalization again. And the Ministry of Health is still working on this issue because it didn't go through the Welfare Committee. So the next step that the minister decides to do is to appoint a committee that is tasked to redesign the bill, previous bill from 2021, redesign the bill and define the thresholds. This was a really large committee. I was asked to head it. There were 13 people, various stakeholders, and obviously you can, you know where the discussion went, all over the place, and nobody could agree on anything. And then the only thing that all of the people could agree on was that there was a need for official governmental policy and action plan on harm reduction as a concept and all of the things that you can put under the umbrella, including drug policy reform. So this year, 2023, Helga submits the bill about decriminalization again, and the Ministry of Health appoints a new committee that is asked to create the governmental policy and action plan in harm reduction. And again, I'm asked to head that committee, and we have had the first meeting, and it's really promising, and we're using the policy development process that was used to develop the policy for mental health in Iceland. So if you kind of look at this timeline, one can hypothesize that the Helga and the Pirate Party are really influential in moving and having the drug reform discussion on the table in the parliament, and the government is responding, moving the discussion forward, hopefully. So I hope this was at some point informative for you, and I look forward to the discussions during the next 2 days.